webcast is now starting. All attendees are in listen-only mode.
Hello, and welcome to today's webinar, PFAS in Drinking Water, an update on research and regulations. My name is Michelle Dixon, and I am the Program and Development Director for the Massachusetts Breast Cancer Coalition, and I'd like to thank you all for joining us. I am very pleased to welcome back our speakers today, Dr. Laurel Schaider and Alyson McCann. Dr. Schaider is a research scientist at Silent Spring Institute, where she leads the Institute's Cape Cod water quality research on PFAS and other contaminants of emerging concern. Her areas of expertise include environmental chemistry, environmental engineering, and exposure assessment. She is a leader in characterizing sources and exposures related to highly fluorinated chemicals, pharmaceuticals, and other unregulated emerging contaminants. Her current research focuses on PFAS in drinking water and consumer products, septic systems as sources of unregulated drinking water contaminants, and disparities in drinking water quality in relation to socioeconomic status of communities across the U.S. Alyson McCann is the Cooperative Extension Water Quality Coordinator in the College of Environment and Life Sciences at the University of Rhode Island. She has over 25 years of experience developing and delivering local, regional, and national programs focused on water resource protection for a variety of audiences, the impact of which has been to affect behavior change to achieve public and environmental health protection. She has a history of effectively coordinating community and governmental engagement activities, working with local, state, regional, and federal partners to achieve water quality protection. Laurel and Alyson, thank you both for joining us today, and welcome.
Thank you, Michelle.
Thank you, Michelle. Thank you, everyone, for tuning in today, and thanks to the Mass Breast Cancer Coalition for hosting us for this webinar today. Our goal is to update you on what's happening locally and across the U.S. with respect to PFASs in drinking water. We'll also update you on some of our activities related to PFASs in drinking water here in Massachusetts as part of the SEEP Superfund Research Program. SEEP is a collaborative research project led by the University of Rhode Island and also including researchers from Harvard University and Silent Spring Institute. MBCC is a local partner of the SEEP project for activities related to community engagement here in Massachusetts. I'm going to start off with an update on what's happening at a state and local level with respect to PFASs in drinking water. If you'd like additional information, Alyson and I gave a webinar last year that provided some more background information about PFASs, and that's available on the MBCC website. Following my presentation, Alyson will give you an update on some of our recent activities for the SEEP project. PFASs make headline news every single day, both at the local level, specifically on Martha's Vineyard. Private wells were discovered to have PFAS contamination close to the Martha's Vineyard airport. There have also been developments just this month at the state and federal level as well. So today I'll give a brief introduction to PFASs and why they are a concern. I'll talk about what is happening across the country at a federal level with respect to regulations, and then talk specifically about some updates here in Massachusetts. PFASs or PFAS are per and polyfluoroalkyl substances. This is a class of chemicals that are widely used in industrial and consumer products. There are some characteristics that make PFAS pretty unique. One is their extreme persistence. They have many carbon-fluorine bonds, which are some of the strongest bonds in nature. These chemicals, which are all man-made, have been described as forever chemicals because they're so resistant to breakdown. This is also a very complex group of chemicals. It's estimated that there are over 4,700 chemicals and polymers currently used in the global market. There's also a very versatile class of chemicals. They have both oil and water resistant properties, which makes them really useful for many applications. This shows the chemical structure of the two most frequently found and studied PFAS chemicals, PFOS or PFOS and PFOA or C8. That blue zigzag that you see in the middle is a carbon backbone, and the X all around that represent the fluorine atoms that are the hallmark of this family of chemicals. PFASs are widely used in consumer products, such as non-stick pans, certain types of food packaging, stain-resistant carpets and furniture, waterproof apparel. So think of things like Gore-Tex, Scotchgard, Stainmaster, and Teflon. Even certain types of dental floss like Oral-B Glide contain Teflon as well. Today I'll mostly be talking about water quality, but I did want to mention that some of our work here at Silent Spring Institute has also addressed other pathways of potential PFAS exposure, such as food packaging and dental floss. PFASs have been in products for decades, but they haven't really been making headline news until recently. And I think the main reason for that is that they've been showing up in drinking water all across the country. One of the major sources of drinking water contamination is a certain class of firefighting foams called AFFF. And these PFAS chemicals are showing up near military bases, airports, and fire training areas where these foams are used for training activities or to put out fuel fires, say if an airplane catches on fire. High levels have also been found near 3M and DuPont facilities where these chemicals are manufactured. Other industries that don't create these chemicals do use them to create other products. So for instance, here in New England, there's been contamination related to St. Gobain facilities in Merrimack, New Hampshire, and Bennington, Vermont, and Hoosick Falls that use products containing Teflon. Then there are many other potential sources of PFASs as well, including landfills, wastewater treatment plants, and even septic systems. Some of our work on Cape Cod has shown that low levels of PFASs can be common in groundwater, and we think that septic systems can be a source. We see that public water supplies close to some of these major sources are more likely to have detectable PFAS levels. This was a study published in 2016 by some of our colleagues at STEEP from Harvard University, and it found that public water supplies close to military fire training areas, major production facilities, and certain airports were much more likely to have detectable levels of PFAS. So why is this a concern? Well, nearly all Americans have detectable levels of PFAS in their blood. This is according to testing coordinated by the Centers for Disease Control and Protection. Certain PFAS chemicals can stay in our bodies for years. So this doesn't just have to do with the chemicals themselves being very persistent, but especially for what we call long-chain PFASs, like PFAS and PFOA, our bodies have a hard time excreting them, and so they can stick around in our body for years. Newer chemicals that are meant to replace PFAS and PFOA don't stick around in our body for quite as long, but what we do know suggests that they have half-lives in our body for weeks to months. And so that does still raise concern about their ability to stay in our body for extended periods of time. Much of what we know about the harmful health effects of PFASs are limited to long-chain compounds, but there's growing evidence that some of the replacement compounds raise the same types of health concerns. Some of the harmful health effects associated with PFAS exposure include immunotoxicity, specifically decreased vaccine response in children, elevated cholesterol, thyroid disease, cancer, including liver, testicular, and pancreatic cancer, and altered mammary gland development. And scientists are concerned that changes in mammary gland development might increase susceptibility to breast cancer later in life. So what's happening across the country? And again, I'm mostly focusing on updates that have happened since we updated the MBCC audience last May. So PFASs are not currently regulated in drinking water, but EPA did require large public water supplies across the U.S. to test for 6 PFASs from 2013 to 2015. This was called the UCMR 3 program. That testing revealed that over 16 million Americans had detectable PFAS levels according to this testing. And I would note that the reporting limits associated with this testing were in the tens of parts per trillion. So that means that the lowest levels that the analytical labs would report back to water supplies was relatively high, especially given that we're looking at some state drinking water guidelines currently being on the order of tens of parts per trillion. So this is likely an underestimate of water supplies that have PFAS across the country. This map here was put together by the Environmental Working Group and the Social Science and Environmental Health Research Initiative at Northeastern University. It shows where PFASs were detected as part of that UCMR program in blue, and then the red dots also show contamination sites where researchers at Northeastern have tracked the extent of contamination and local response. The Environmental Working Group estimates that potentially as many as 110 million Americans may have PFASs in their drinking water if we look at having a lower reporting limit, more in the order of 5 parts per trillion. So this is really a nationwide problem, and we have growing awareness of the extent of contamination. Currently, there are no federal enforceable drinking water standards, what we call maximum contaminant levels, for any PFAS chemicals. The EPA and some states have developed non-enforceable health advisories for PFAS, PFOA, and several other PFAS compounds. New Jersey actually does have an MCL for another PFAS chemical called PFNA, and New Hampshire and Massachusetts, as I'll talk about, are considering having enforceable standards as well. So over time, what we see is that the levels that are being regulated or considered have gone down. In 2009, the EPA issued provisional health advisories of 400 parts per trillion for PFOA and 200 parts per trillion for PFAS. Then in 2016, the EPA issued a lifetime health advisory of 70 parts per trillion for the sum of both chemicals, so almost 10 times lower. So this means that EPA is considering for long-term exposure much lower levels in drinking water. After the EPA came out with its lifetime health advisories in 2016, a number of states have responded by coming up with their own guidelines that are even lower than the EPA guidelines, including Vermont, Minnesota, New Jersey, New Hampshire, and most recently New York, which recently suggested guidelines of 10 parts per trillion for both PFAS and PFOA. My colleagues and I recently published a paper that evaluates the reasons why states have come up with such a variety of approaches to regulating drinking water. And there are some states that actually have advisories that are higher than the EPA advisory. Some of the reasons we see these differences include evolving scientific understanding. As we learn more and more about how these chemicals can be harmful, we start to think about lower levels of exposure as being of concern. There can also be different interpretations of available science. So I'll give as an example effects on mammary gland development. The New Jersey Department of Environmental Protection included an extra margin of error, safety factor, in developing their drinking water guidelines for PFOA because of concerns about mammary gland development. And although the standard was not specifically based on that health endpoint, it was used to create their lower drinking water guidelines. Texas also considered mammary gland development as their critical health endpoint that they based their drinking water standard on, but because of other assumptions, they came up with a much higher guideline. So different states can come up with different numbers because of assumptions about water consumption and exposure from other sources as well. There can also be different assumptions about who is the most sensitive population and how best to protect them. So for instance, we know that in the womb and early in life, our bodies are especially sensitive to PFAS exposure. The Agency for Toxic Substance and Disease Registry, or ATSDR, released a toxicological profile in June last year. And there was some controversy surrounding the release of this report because it had been rumored that the EPA was trying to prevent the toxicological profile from being published. As part of this, the ATSDR evaluated available health information for 14 PFAS chemicals and came up with minimal risk levels for 4 of these PFAS compounds. So a minimal risk level is intended to represent a level of exposure unlikely to cause harmful health effects. And what got so much attention was that the minimal risk levels developed by ATSDR were much lower than the risk levels that EPA used when they were developing their drinking water guidelines. So for PFAS, the ATSDR values were 10 times lower, and for PFOA, they were 7 times lower. So this got a lot of people's attention and made people wonder if the EPA guideline might not be adequately protective. The ATSDR also developed minimal risk levels for PFNA and PFHXS. So the EPA in May came up with a PFAS management plan resulting from a summit that they held with mostly state stakeholders. And they came up with four components to this plan. They said they would evaluate the need for PFAS and PFOA drinking water standards, or MCLs. They would consider classifying PFASs as hazardous substances under CERCLA, which is the Superfund law, or another regulation. And this is important because currently PFASs are not listed as hazardous substances under Superfund, and this has limited the ability to go after responsible parties for contamination. So if PFASs are listed as hazardous substances, that makes it easier to promote remediation and cleanup. The third point was to develop groundwater cleanup standards for PFAS and PFOA, and the fourth was to conduct risk assessment for Gen X and PFBS. These are 2 of the newer replacement PFAS compounds. Gen X has been in the news quite a bit in North Carolina because there's been contamination of drinking water close to a Chemours, which was formerly DuPont facility. There was also a series of community listening sessions, including this one in Exeter, New Hampshire in June, where community members had a chance to talk about their community's experience with PFAS water contamination. So it's difficult to create slides ahead of time for a talk such as this because the landscape really changes on a daily basis. So just last night, an article came out in Politico that said that the EPA has decided not to create MCLs for PFAS and PFOA. I haven't seen anything official from EPA, but this suggests that there won't be drinking water standards created anytime soon for these 2 PFAS chemicals. The article did say that EPA had decided to classify PFASs, PFAS and PFOA specifically, as hazardous substances under CERCLA. So this will help with identifying contaminated sites as Superfund sites, which will promote their cleanup. And then EPA did also release a draft risk assessment for Gen X and PFBS, and that was open for public comment. Some scientists are concerned that those were not adequately protective. And it remains to be seen what next steps EPA will take on all of this. So what's happening here in Massachusetts? So resulting from the UCMR3 testing, again, that's 2013 to 2015, there were 5 public water supplies in Massachusetts that had detectable PFAS levels. Again, I'll point out that the reporting limits associated with this testing were not extremely sensitive. So this was really picking up the water supplies that had the highest levels of PFAS. Some of these communities had water contamination associated with the AFFF firefighting foam from fire training. The highest levels were seen in Hyannis on Cape Cod, and in Westfield and Mashpee. There have also been wells taken offline because of PFASs from firefighting foams. Hudson and Danvers also showed up as part of that testing. In Hudson, I believe that the source is an industrial-related source, and I'm not sure that that the source in Danvers has been identified, at least from the most recent presentation I saw from DEP on this. There's been additional testing since the UCMR program. The water supply in air in Devens has also been found to have PFAS related to firefighting foams. And just last month, private wells in Martha's Vineyard were found to exceed the EPA's health advisory in close proximity to the Martha's Vineyard airport. So as I mentioned, the reporting limits associated with the UCMR testing were not very sensitive, and some of the labs were able to detect levels of PFAS, but they didn't have to report on those levels. So reanalysis by one of the laboratories that conducted PFAS testing as part of UCMR found that many more water supplies had detectable levels than previously reported if they used a lower and more sensitive reporting limit. So instead of 10, 20, up to 90 parts per trillion, when they reanalyzed their data, they found that many more water supplies had levels of PFAS and PFOA over 5 parts per trillion. And this, I've zoomed in just on the Northeast here, you can see that over 40 public water supplies have PFAS or PFOA detectable at levels above 5 parts per trillion. But as, up to now, we don't know which ones those are. So I'll talk a little bit now about what Mass Department of Environmental Protection has been doing to respond. In June 2018, Mass DEP issued a public health guideline, which is called an ORSG, that said that the sum of 5 PFASs should not exceed 70 parts per trillion. So this is somewhat more restrictive than EPA's guideline, which only considers 2 compounds. Then in October, there was a petition from the Conservation Law Foundation and Toxics Action Center prompting DEP or asking DEP to do more. They wanted to see enforceable standards of PFASs in drinking water and suggested that a treatment technique approach might be appropriate, given that PFASs are a broad family of chemicals and it's kind of an impossible task to develop a drinking water standard for each compound individually. Just last week, there was a public hearing related to this petition organized by DEP. You can see me there at the top. And the bottom picture shows Cheryl Osimo, who's MBCC's executive director and our Silent Spring outreach coordinator, making comments. And over 20 people from the audience made comments in response to the petition, and people from DEP spoke as well. And just yesterday, DEP issued its official response to the petition. And I'll be honest, I haven't read every word of it because it did just come out yesterday. But from a quick read, some of the next steps identified by DEP include starting the process to develop enforceable standards, not just guidelines, for PFASs in drinking water. It looks like they're considering just the same 5 that they already have included in their guidelines. They also plan to start the process of developing standards for waste site cleanup, and this is important for remediating contaminated sites. They said they would also consider standards developed by Vermont and other states. And regarding that point about that I showed on the previous slide about water systems in Massachusetts having detectable PFAS, they're asking water suppliers to ask the analytical labs that ran their samples to find out more information about PFAS levels in their drinking water. So you might be wondering, well, how do I know if there are PFASs in my drinking water? So if you're on a public water supply, you can call your local water district or look up consumer confident reports online. If your water system has over 10,000 customers, then it would have been included in the UCMR testing. The DEP has information on its website regarding the results of the UCMR testing and also more recent test results as part of its EEA portal. If you're on a private well, we certainly have a lot less information about PFASs in private wells, and there's been very little testing of PFASs in private wells. You can talk to your town's health agent to see if they have conducted any testing or to see if there are any sources of concern in your area. And if you live on Cape Cod and you have a private well, then you're eligible to get your water tested as part of the STEEP program. And Alyson will talk more now about what we've been up to as part of STEEP.
Okay, thanks, Laurel. So I believe my screen is being shown now. We just did the switch over. It's a pleasure to be here, and thanks to the participants for joining us. I'm going to talk a bit about our STEEP project and focus primarily on our private well water testing. STEEP stands for Sources, Transport, Exposure, and Effects of PFASs. And as Laurel mentioned earlier, it is a partnership project led by the University of Rhode Island in partnership with the Harvard T.H. Chan School of Public Health and the Silent Spring Institute. It's funded by the National Institute of Environmental Health Sciences Superfund Research Project. It's a 5-year project, initially funded in 2018. Our mission for STEEP is to address the human health threat from PFASs using rigorous interdisciplinary science to redefine exposure benchmarks, develop novel detection techniques, and prepare communities to expect long-term solutions for contaminated sites. Last year on this webinar, we did go over in more detail the various components of the project, and I just review them here on this slide, but I would invite you to visit our STEEP web page. I'll have that web address in subsequent slides to look at, and if you're interested in knowing more detail around the research projects, of which there are 4. One focused on childhood health, one on metabolic effects, another on environmental fingerprinting, and then finally detection tools is the 4th research project. In addition, there are 4 cores, one of which is the Community Engagement Core, which Laurel and I co-lead, our Research Translation Core, a Training Core for graduate student training, and then an Administrative Core. So focusing on the community engagement piece, much of our work for the Community Engagement Core is focused on Cape Cod, where we're working with a number of community partners, including the Massachusetts Breast Cancer Coalition, the Sierra Club Cape Cod Group, and our STEEP Cape Cod Advisory Committee. And we continue to expand and strengthen partnerships on Cape Cod. For example, this past fall, we partnered with the Mashpee Wampanoag tribe to co-host a movie entitled The Devil We Know, focused on a community impacted by PFASs, and followed that movie by a question and answer period with some of our STEEP partners. Our CEC activities, our Community Engagement Core activities, some of the highlights include an annual STEEP Science Day on Cape Cod, where researchers and our graduate student trainees can share research findings for stakeholders and community members to ask questions, so to provide a bi-directional forum for the exchange of information, the exchange of concerns and questions, and participate in community events and be responsive to the community's needs by providing scientific expertise in response to local questions and concerns, and also to promote and implement prevention and intervention strategies to reduce exposure to PFASs. As I mentioned, and Laurel mentioned too, our STEEP's focus for community engagement activities is on Cape Cod, where there's a vulnerable sole source aquifer. The groundwater resources on Cape Cod were designated as a sole source aquifer by the U.S. Environmental Protection Agency back in 1982, which basically indicates that as a sole source aquifer, that the groundwater resources are the principal source of drinking water for Cape Cod, and that no alternative exists. We know that there AFFF contamination of both public and private drinking water wells on Cape Cod. There's a history of community engaged research that Silent Spring has done over the years and brings to the table as a partner in the STEEP project. And then community concerns about water quality and health in vis-a-vis PFASs. The groundwater resources on Cape Cod consists of 6 interconnected groundwater lenses, if you will, and they're highlighted here on this slide in different colors to show these groundwater resources. On Cape Cod, approximately 80% of the population rely on public water for their drinking water, which leaves about 20% on private wells, which is a little bit higher than the estimated national average. Nationally, it's estimated that 15% of our population rely on private wells for their drinking water supply. Here are highlighted areas in blue of areas on Cape Cod that are dependent upon private well water for their drinking water. These data are from the Cape Cod Commission. And then the areas in red are areas that are sewered on Cape Cod. And I'll talk a little bit about that when I go into the testing that we're doing. One of our, as Laurel mentioned earlier, septic systems have been suspected as a possible source of PFASs in groundwater and hence in drinking water. And so looking at areas that are serviced on Cape Cod, looking at areas that are serviced both by private wells and that are unsewered, if well water comes back with PFASs present in them, one of the suspected sources could be the septic system. Oops. So as part of our community engagement core efforts, we are doing some private well testing funded by the STEEP project. We have been funded to test 250 wells over a 5-year period, and these samples will be analyzed at Harvard University for over 20 PFASs, and also for some markers of septic system impact, primarily nitrate, which is actually being analyzed at the Barnstable County Health Lab, and boron, which will also be analyzed at Harvard University. We're interested in helping to answer the question and provide residents, health agents, and other local officials, interested community members on Cape Cod with a better understanding of the extent of potential PFAS exposure and contamination. And we're looking to evaluate potential sources of PFASs in coordination with research project number 1 as part of the STEEP work, which is fingerprinting. Being able to, based on the results, if PFASs are present, fingerprinting looking at the results and being able to talk about or say what the suspected sources would be based on the suite of results that may or may not be found. And with this information, be able to inform decision makers related to drinking water protection and wastewater management. On the right-hand side of my slide, you see this was a piece that was developed in partnership with our Research Translation Corps to solicit volunteers, welcome private well owners on the Cape to volunteer for this project. And we received a lot of media coverage, local media coverage, when we kicked off the call for volunteers. Here's a couple of examples of that media coverage, and that certainly helped us to spread the word and to get people interested in volunteering. So to date, we have sampled 101 private wells. We plan to produce a summary of preliminary findings that will be shared in the spring of 2019 as part of our annual Science Day, Steep Science Day update. Here's the website to learn more about the well water work, and if you are a private well owner on Cape Cod and have not yet volunteered, we're still in the process of the call for volunteers is still open, and if you're interested in doing that, you can go onto the website and volunteer. A little bit about being a volunteer. We would come to your home and collect the samples, schedule a time to meet you at your home and collect those samples. And sample results are confidential, and so Laurel and I are aware of who the volunteers are, and that is confidential and private. Your results are confidential, so only the volunteers will get their results, and then we would produce summaries of our findings in terms of general summaries without actually identifying who the results, who was the volunteer or where the volunteer actually lives. This map indicates our private well sampling to date by community and then by time frame. And so we began sampling in August of 2018 and then finished up for this season in December of 2018. And so in green, you see we went out to the elbow of the Cape and collected samples in Brewster, Harwich, and Chatham. The numbers with the check mark next to them indicate the numbers of samples collected in each community, and then the numbers next to the person, the icon of a person, shows how many volunteers we actually have within that community. So our number of volunteers to date is 151. We also, in September, went out to the Outer Cape and sampled in Truro, Wellfleet, Eastham, and Orleans. And then in November and December, we sampled in the Upper Cape. What are we hearing from our volunteers? And so what's very interesting to both Laurel and I are when we go out to collect samples at the homes and we get to meet our volunteers, we're also able to have a conversation with our well owners. And from our volunteers, you know, we're learning about what's important to them, what their concerns are, what inspired them to actually volunteer in this study. Many of our volunteers volunteers are interested in whether or not they're learning about whether or not their water is safe to drink. They're aware of the PFAS issue on Cape Cod, and they want to know if their water is safe to drink, if there's PFAS in their well water. They want to know if their water is contaminated. And they're interested in learning what they can do to reduce their exposure. And what's very helpful for us is to be able to have these conversations with our volunteers, let them know about the STEEP project, how they can contact us for more information, and also in learning about their concerns, we're able to bring that back to our STEEP team and work with other pieces of the STEEP project. In this instance, working with our Research Translation Corps, so that our Research Translation Corps can learn about the concerns of the Cape community and help to develop science-based materials to address those concerns. And so most recently we're developed a couple of different oversized postcards, if you will, to help address, to help inform our audiences about sources of PFAS in the home and what they can do to reduce their exposure in the home on this particular card. And then on this card was are tips for infants. What expecting mothers before pregnancy, what families can do before pregnancy in terms of reducing their exposure to PFAS, during pregnancy, and then postnatal. So that there's, again, this informing of information for our local community in terms of really having some one-on-one contact with people, and then our Research Translation Corps developing these materials to help address that. As I mentioned, there's the opportunity to, if you're a private well owner on Cape Cod and are interested in volunteering to have your well water tested, that the lines are still open to do that. At the bottom of the slide is is our web address to take you there. You would complete an online consent form and a questionnaire about your well. STEEP team members would contact you and then volunteers to see if you're still interested in volunteering, and then we would come out to your home, again, make an appointment and come out to your home to collect samples. You'd receive a detailed online report back that will be developed with your results and information about treatment, if necessary, and how to reduce your exposure in your home. That's what I have as an update for the STEEP project.
Terrific. Well, we've got a number of questions, so I want to get to those. Could you speak to the difference between Mass DEP developing an MCL for these chemicals in drinking water and developing site waste cleanup approaches versus what CLF technology-based cleanup approach that they had in their petition?
Okay, so this is Laurel. I'll take a pass at answering that question. So the question was, what's different about DEP's response relative to what CLF and Toxic Action had in their petition? So the petition had requested that DEP kind of, as an immediate next step, create an enforceable standard and lower that to 20 parts per trillion for the sum of 5, which would mirror what Vermont has done. And then it would also, they wanted DEP to have a treatment technique-based approach. So again, rather than having an individual level for each individual compound. And the goal would be to have the total amount of PFAS in water be 1 part per trillion for all the different compounds that might be detected. So again, I haven't read all of the DEP document in depth because it just came out yesterday. It looks like as a next step, they would consider creating an MCL, and that the advantage of that over a guideline is that it would be enforceable and it would require public water supplies to routinely monitor for these chemicals. The response didn't say what that level, that total amount would be for the sum of 5. That's something that they would still be working on. So it's partially responsive to what was in the petition by being enforceable, but it's based on measuring specific compounds rather than requiring a treatment technique. The petition didn't relate specifically to cleanup of contaminated sites. It was just related to drinking water. So DEP, in creating standards for soil and water at contaminated sites, would support remediation of contaminated sites by making it really clear the targets, the goals for ensuring that that contaminated sites are not contaminating drinking water or the environment.
Okay, great. Is there any testing of wastewater or filtration from firefighting stations where the turnout gear is washed and cleaned before discharging into the various rivers?
This is Laurel again. That's a great question. I'm not aware of any testing like that underway right now in Massachusetts. That doesn't mean there isn't, but I'm not aware of any.
Right. Neither am I.
Okay. And I know, Alyson, I believe you touched on this, and we've got a number of questions on this. You said that the volunteers, of course, want to know, they volunteer because they're concerned about their level of contamination. A number of the questions that we're getting from our audience is, what do you do once you learn that your water is contaminated?
So based on the results of what we're testing for, next steps, depending on the levels that are found, and because these aren't, at this point enforceable standards, but based on the levels that are found in drinking water, the next steps may be for treating the water. Particularly for either nitrates, which does have a drinking water standard associated with it, and is part of what we're testing for. And then for PFASs, there may be treatment that is also necessary, based on the results, which could be either activated carbon or reverse osmosis treatment in the house.
Okay.
Does that help answer that?
I think so. And then I'm getting a number of questions also around the definition of lifetime exposure.
Right. So there are different ways that chemicals can be regulated, I guess, making different assumptions about the duration of exposure. So the provisional health advisories that EPA generated in 2009 were designed to be protective for short-term exposure. I was never clear how short that exposure was meant to encompass, but sort of shorter duration exposures. And the assumptions that go into the development of a lifetime health advisory are sort of chronic exposure to drinking water at a certain level over an entire lifetime.
Right, which in many cases that would be considered 70 years.
Okay.
Drinking that water for 70 years over the course of a lifetime. Correct.
Okay. And it can depend a little bit on which health endpoint is being considered because there are some types of toxicity that relate just to early life. For instance, there's evidence of PFAS exposure being linked to low birth weight. And so that would be sort of a shorter window of exposure. But the goal of the Lifetime Health Advisory is to encompass exposures, like Alyson said, over 70 years across all health endpoints.
Okay, thank you. A couple of questions from people who want to know, well, why this whack-a-mole approach? It seems like we're only touching on a few of these chemicals instead of treating them as the complete class.
Right.
Is
so
that
that's a great
is that
question.
science driven, or is that political?
I'll take a first pass at this, and then Alyson might want to add on. I mean, we often regulate chemicals and think about chemicals one at a time, and it has been described as this whack-a-mole approach. Another example is bisphenol A. So BPA was identified as being harmful, for instance, as an estrogen mimic. And so products were, because of consumer pressure mainly, products were swapped out, and now you can buy BPA-free plastic bottles. The problem is that when we take these chemicals one at a time, we often don't look at the whole family of related chemicals. So now in plastics, you can find other bisphenol chemicals like bisphenol F and bisphenol S, and they have very similar chemical structures. And what often happens is once we identify one chemical as harmful, that chemical often serves a certain role in the product. And manufacturers want to swap out a chemical which is very similar because it will serve a similar function in the product without having to reformulate the whole product. But often what happens is that chemically similar chemicals will have the same effect. So for PFAS, these long chain chemicals like PFAS and PFOA have been identified as concerns, and in their place are other replacement compounds. Some are what we call short chain, so that blue zigzag I showed earlier on is shorter. In other cases, it looks very similar, but doesn't fall under that same technical definition of being long chain. And that's just how our regulations often work. And it's kind of a complicated class of chemicals, and trying to distinguish between PFAS, PFOS, and PFOA. It's a lot of acronyms, and it's hard to keep track of. But what's happening now is a substitution for these replacements. There is more of a push to take a class-based approach. So for instance, the state of Washington banned PFAS as a class in fast food or in food packaging, as did the city of San Francisco. And Washington state has also banned PFAS in firefighting foams, except where they're required to be there by federal law. And I think it is a little easier on the front end to keep PFAS out of products in the first place, because we know that we're adding them. Trying to treat them as a class at the tail end in drinking water is a lot more challenging, because we often don't even have the analytical methods to measure so many different individual chemicals.
Thank you. Alyson, did you want to add on before I move on?
The only thing that I would add on is that the Conservation Law Foundation has also requested that these be regulated as a class of chemicals and not individually. So as Laurel said, there is a push to do that. It is difficult. On the same hand, it is difficult to do that.
Are there any studies that you're currently undertaking focusing at all on babies and children's exposure given their vulnerability factors?
So for the STEEP project, one of the other research projects is led by Philippe Grandjean at Harvard University. He's done a lot of work in children in the Faroe Islands. Earlier on, he studied mercury and PCBs, and his work most recently has focused on PFASs. And his research has been really important in showing immune system effects in children, like I mentioned, with impaired vaccine response. And he, through the STEEP program, is also now looking at effects on metabolism. Here at Silent Spring Institute, we have another research project called PFAS Reach. This is research, education, and action for community health. And one component of that research will be a study of effects on children's immune systems, kind of paralleling what Dr. Grandjean has done in the Faroe Islands, but in a U.S. population and in children who may have been exposed from drinking water contamination. And for that project, we'll be focusing on Hyannis and at the Pease Trade Port in Portsmouth, New Hampshire. And we anticipate being able to start recruiting for that study later on in the spring.
That's great.
Terrific. And can you, as a follow-up to that, for those who live in Central and Western Mass, I've got a couple of questions who want to know how, if you can provide some guidance on how to bring this kind of study and work to their areas.
You mean the STEEP project study?
Yeah, in the forms of how do we bring some kind of you know, these kinds of volunteer testing and other community outreach to Central and Western Mass?
Well, part of some of the outreach pieces can certainly be transported to Western Mass. We have, you know, we have written material. I would say the best thing to do would be to contact us. In terms of the volunteer study for private wells, we are funded to do that private well testing on Cape Cod as part of this project. But I think that, you know, if there's interest in some of the details about what we're doing in terms of, you know, soliciting volunteers and working with volunteers, you know, we'd be happy to have a conversation with these people in terms of, you know, how to transport some of our lessons learned to another area. But as I mentioned, our funding for that is our funding to do private well testing is focused on Cape Cod at this point in this 5-year project.
Okay.
Yeah, and just to build on what Alyson was saying, a couple other points. I neglected to mention that there will be a conference at Northeastern University on June 10th to 12th. This is a joint endeavor of Northeastern University, Silent Spring Institute, Toxic Section Center, Michigan State, and other organizations. We organized a conference in 2017, so this is kind of the second one. And STEEP is also a co-organizer of that conference. And what was really unique about the conference was that it was really geared for affected communities. We did have scientists and lawyers and journalists, but really our main goal was to have a conversation with affected communities, hear about their concerns and questions, and foster partnerships. And as Alyson mentioned, for the STEEP study specifically, we're funded to do the water testing on Cape Cod, but there can be other opportunities for researchers and community members to apply for grants to do water testing or to do biomonitoring to see what people's blood levels are like. But again, as Alyson said, feel free to reach out to us as well.
Yeah.
Well, we still have questions still coming in, and unfortunately we're up against the clock and out of time. I would invite anyone who still has questions to please, you can send them to me and I will get them to Alyson and Laurel, or you can send them directly. You see their contact information on the screen. Ladies, I want to thank you both. Clearly, this is an important topic to a lot of us, and still so many questions, and the information that you've provided for us today, this update, has been tremendously helpful and insightful, and so thank you for that. And on behalf of Cheryl Osimo, MBCC's Executive Director, and our Board of Directors, I want to say thank you to both of you and to our many listeners for participating today. For those who are interested in receiving the recording of this webinar, it will be made available later today on the MBCC website at www.mbcc.org. Alyson and Laurel, thank you again. And to everyone, have a good afternoon.
Thank you, Michelle. Thank you to MBCC for hosting us.